on both sides. However, they're unaware that the lesser of the two blocked ears, should I say, is actually blocked, because in comparison to their really blocked ear, they feel they can hear so much better. And it's only once we remove the earwax from the worst ear, the bad ear, like we are doing in this case, because the patient felt this is the worst ear, that they then notice that their opposite ear is actually also blocked, because they're now comparing that to their now good hearing unblocked ear. Now, this patient's got quite a narrow, twisty ear canal, more so in the right side. So if you stay tuned, you'll see the right procedure. You can see the ear's a bit more narrower than the left, but nonetheless, this ear is also quite narrow. It's quite bendy. Everyone's got an S bend of the ear canal. And so the first bend is around 0.5 centimetre into the ear canal. The second bend is about 1 centimetre into the ear canal, and that's where the bony part of the ear canal and the cartilaginous portion of the ear canal meet. And the inner 2/3 of the ear canal is full of bone, and it's a bit more straighter in that respect, but about 0.5 centimetre near the eardrum, the ear canal then narrows. We call that the isthmus. And then it widens, it expands back outwards again. And when it does, it creates an inferior recess, so a trench, a basin, if you like, at the bottom of the eardrum. And also to the front part of the eardrum, we call that the anterior part. There's a recess there also, and quite often you can get wax and dead keratin trapped in there. Patient had been possibly over-oiling the ear. They typically would have their ears irrigated at the doctor's. However, in the UK, most GPs and surgeries now are no longer offering ear irrigation services, and partly because they are under-resourced, and contrary to belief in the UK, although the NICE guidelines and NHS England want GPs to remove wax, there's no funding given for that, offering that provision to the patients, and therefore it's quite difficult for GP practices to continue offering that. So I've removed that dead skin and wax. You'll see at the entrance of the ear canal there's a trench there, there's a widening expansion. There's just a little speck of soft wax on the eardrum, and I thought, let me just remove that. So I've just attached a fine end gauge. Now you'll see the patient suddenly move. They were surprised by the noise. When this wax got suctioned up, it made a slurpy noise. And I quickly just came out of the ears. We don't want to cause any trauma. It just startled the patient. There we are. So I came out and just make sure there was no trauma. The patient kind of apologised. I said, no, there's nothing to apologise. It's just startled them. They were now acclimatised to the noise of that wax. I know what to expect. So I just went back in gently, removed that. There's a bit left, a bit higher up. There's no point in me trying to perforating the eardrum in an attempt to remove that. So I'm just mopping up near the entrance. You can just see here as we enter, the ear canal goes down. There's a downward slope. There's like a little hill, a little valley. And that could be one of the reasons why the patient is getting an impaction in this ear in particular. The skin and the wax, as it's migrating out of the ear, it's getting trapped in this recess at the bottom of the ear canal near the entrance. So the inferior recess, what I mentioned and described before, we'll normally see a recess like this near the eardrum. But in this case, the patient's also got a recess right near the entrance. Lovely, healthy appearing eardrum. They've got a good light reflex, so the left ear can hear significantly better. And it's only once I removed the wax from the left ear, and they then noticed this ear was also blocked. You can see just how much narrower this ear canal is. I can just about insert the standard Zollner suction probe. So the diameter of a standard Zollner suction probe, I think it's 2.2 millimeters. The internal diameter is 2, I believe, and the external is 2.2, 2.3. And it just about fits in. And this plug of wax is enveloped by some skin. I think I'm going to use some olive oil drops in there. They didn't feel that this ear was blocked at all. Now, the reason why I made reference to this patient normally gets their ears irrigated is because, as I mentioned, the patient's been using quite a lot of drops and they've almost OTT'd it in their left ear. And the reason for the patient using the drops in the first instance is if you're having your ears irrigated, so flushed out with water, there's almost a prerequisite that you use the drops, softening drops, whether it be olive oil or hydrogen peroxide or sodium bicarbonate, for 10 to 14 days. So that wax is almost in a liquid state, liquid form, so it's easier to flush out. During that time, however, whilst you're using the drops, obviously it's a messy business, you've got oil seeping out of your ear, but quite often the wax plug can absorb the oil and whatever drops you're using and expand and swell. And quite commonly also the drop seeps in behind the wax plug, creates a puddle near the eardrum, and again the patient can't hear for that reason. So that oil worked really well, it binded that skin and wax, managed to remove it. Similarly to the left ear, the patient has got a slight trench, a recess at the entrance as well. I'm just mopping that up with a fine end gauge. You'll have a nice view of the eardrum there. Just where I'm examining the ear now. It's not as prominent a trench as the patient's left ear. Nonetheless, if wax and skin gets trapped in that little cave valley, it can be difficult for it to be then self-migrate. That's all the remnants, all the debris, all the skin, wax from both ears. You can see the different contrasting colours. At the bottom, it was all the fresher secreted wax, keratin, so it's light yellow almost. And as you go up, it was getting darker and darker. I tried to position it in such a way so you can see the colour trends. So freshly secreted wax and keratin, it's a light yellow, and as it ages and matures and oxidizes, it turns dark.